If I get something rapidly and we have a formal diagnosis and we can move forward on it, and that's part of the sports medicine background, then we could probably decrease their time to recovery by half, sometimes faster. For example, if you have a medial collateral ligament injury in the knee, which is not a surgical issue necessarily, but if you sit on that for a couple of weeks and it gets stiff, it costs you 6 weeks. If we get that the same day or the next day, it cuts it down to 2 weeks, depending on what it is and how rapidly we can do it with those kind of injuries. And so for me, I would much rather have someone come from the ER, from the prompt care, from the primary care the same day or the next day so we can define the injury fully and attack it, as opposed to just kind of saying wait 2 weeks and then see how it's doing. To me, that technique is really not the best thing for the fastest recovery for injuries, particularly when you have someone who has an activity they want to do. You're better off to get it calm, attack it with rehab if that's necessary, or surgery, whatever it is, so you put them in the best position to come back as fast as they possibly can. And so the less scarring you can produce, the better off you are. The faster you can rehab. For example, our ACL reconstructions now, we can have return to play in 4.5 months. And that's better than anybody in the country. And part of that's because of the structures we use to rebuild it. But also, part of that is because we place them in rehab and we integrate that program so that we have them very functional. Most of those people can run by 6 weeks. And so that's a rehab issue, but it's also the arthroscope and being able to make small incisions. I mean, literally, for an ACL reconstruction, my incision's that big. And you can rebuild that whole ligament. Some of the knee reconstructions now where you fix a torn ACL, the incisions are this big, right? That big. And so you can make a tiny incision and do all that through one tiny hole and 2 puncture wounds.